Glaucoma presents a video series with editorially independent content supported with advertising.
Are there glaucoma drops that are gentler to the eye? What are they and how should one use them? Well, in this video, I'm going to shed some light on just that. Hello, and welcome to the Glaucoma YouTube channel. My name is Dr. Constance Okeke, glaucoma specialist, cataract surgeon, and creator of this MIGS Meds University video series. As glaucoma is a chronic condition with the most common treatment being the use of topical eye drops, the active ingredients within the drops, as well as the preservatives, the most common one being benzalkonium chloride, which is present in about 70% of eye drops, these can have a lasting negative effect on the ocular surface, causing toxicity and ocular surface disease. We all know ensuing symptoms such as redness, tearing, irritation, burning, foreign body sensation, light sensitivity, and intermittent blurred vision can disrupt quality of life and lead to non-compliance with glaucoma treatments. See my other video to learn more about the toxic effects of the most common topical preservative, benzalkonium chloride, or BAK. So, what are the gentle glaucoma drops? Well, they are the drops that do not have BAK, and they come in the classes of alpha-agonists, beta blockers, prostaglandin analogs, and fixed combination medications. These drops have either no preservatives at all or contain preservatives that have been shown to be less toxic to the ocular surface compared with BAK. So let's see what these drops are. In the class of alpha-agonists, there is Alpha-Gan-P or brimonidine tartrate 0.15%, which is produced by Allergan. It is preserved with purite, which is a stabilized oxychloro complex that has broad antimicrobial activity through oxidative damage. It has been demonstrated in clinical studies that purite, as a substitute to BAK, does improve patients' comfort. In the class of beta blockers, there is Timoptic and Ocudose, or timolol maleate ophthalmic solution 0.25% and 0.5%, produced by Bausch & Lomb. This medication is preservative-free and comes in single-dose unit vials. In the class of prostaglandin analogs, there are four. First, Travatan Z or Travoprost 0.004%, which is made by Alcon and is preserved with Sofzia. This is a preservative which is an ionic buffer composed of boric acid, propylene glycol, sorbitol, and zinc chloride. In one study, Travatan Z resulted in less keratopathy and less conjunctival hyperemia than did Travoprost, preserved with BAK. The second is Zioptan, or Tafluprost, ophthalmic solution 0.0015%, which is produced by Acorn. It is the only preservative-free prostaglandin analog, and it comes in single-dose vials. Third is Zelpros, or Lantanoprost ophthalmic solution 0.005%, which is produced by Sun Pharmaceuticals and is preserved with potassium sorbate. Zelpros is able to penetrate the cornea with a novel lipexcel technology. This drop has been shown to be very well tolerated. And the fourth is Durista, which is the first of its kind sustained-release implant of bimatoprost, which is made by Allergan. This implant is injected into the anterior chamber of the eye, dissolves over time, and does not contain any preservatives. The implant lowers eye pressure while not causing any toxicity to the corneal surface. In the class of combination medications, the only one that is preservative-free is Cosap PF, or dorzolamide 2%, timolol 0.5%, made by Acorn, and it comes also in single-dose vials. Other combination drops of 2, 3, or 4 medications in one bottle may have BAK as the preservative, but the reduction of actual drops on the ocular surface can still be a benefit overall because of less total preservatives. Let's look at a case scenario to help understand where and when one could consider using one of these gentler drops as an option. A 56-year-old gentleman was recently diagnosed with open-angle glaucoma. His visual acuity was 20/20 in the right eye and 20/25 in the left. Baseline IOP was 22 and 23 millimeters of mercury in the right and left eye respectively. Corneal hysteresis was measured at 10.1 in the right and 9.5 in the left. The central corneal thickness was 522 right, 519 left. His slit lamp exam was remarkable for mild SPK-OU inferiorly and 1 to 2 plus NS-OU. His cup-to ratio was 0.65 in the right and 0.7 in the left.
On Humphrey Visual Field, he had early defects in both eyes, but more in the left eye than the right eye. This correlated with his optic nerve OCT findings.
He was started on Lumigan at night, but he complained of irritation and was not able to afford the medication out of pocket because he had no insurance. He was switched to generic Lantanoprost and still did not tolerate the medication due to surface foreign body sensation, even with the use of artificial tears. The patient was then switched to Zelpros and was able to afford the medication using the Zelpros Express special pharmacy program with a 90-day supply that put the medication at $37 a month with free mail delivery. He was also so comfortable with reduced ocular symptoms on Zelpros that he did not have to use artificial tears. This case gives great reminders of the importance of treating glaucoma or ocular hypertensive patients who also have dry eye disease. It's important to minimize preservatives such as BAK that can be harmful over time and create issues surrounding dry eye disease. Those are some helpful tips and information that I use when I'm trying to decide what medications to consider that are a bit gentler on the eye in glaucoma or ocular hypertensive patients. Hey, grab my glaucoma medications guide in the description box below to get all of the most commonly used glaucoma drops at your fingertips when you're needing to make those decisions. If you like the video, give me a thumbs up and share with a friend or colleague who may benefit from the video. Thanks for watching the iGlaucoma YouTube channel, a place where glaucoma innovation is made easy for eye care professionals.